Medication administration. We will review the 7 rights of medication administration, review common causes of medication errors and how to prevent them, best practices for medication administration, good habits matter, what to do if a med error occurs, considerations relating to Texas law. The 7 rights of medication administration. Right drug, dose, patient, time, route, documentation, and response. Before giving a medication, always compare the name of the ordered drug with the name printed on the medication label. Does the medication label match the order? Be vigilant with a look-alike, sound-alike medication. Drugs with similar sounding and similar looking names may have different indications and effects. Does the strength and dose match the order? Is it half, whole, or multiple tablets? When performing a calculation, it is good practice to double check your answer with someone else in the clinic or a pharmacist. Double check, double check. To reduce the risk of medication errors, never assume that the patient standing in front of you is the patient name on the label of the medication bottle. Always check the student's ID carefully against the medication administration record. For those of you with students who do not wear IDs, you're going to have to be resourceful. Open eSchool Plus. Ask the student their name. Ask their mom's name. Ask them who their teacher is. Ask them their birthday. Compare the student with the school picture in eSchool. Compare the paper orders to the medical alerts listed in eSchool. It is highly recommended that you put the picture of the patient on the medication bottle to store in your medicine cabinet. Does the order match the patient? Ask the patient for their first and last name. It does not matter how many times you have given your patient medication. Always verify their name by asking them, "What's your name?" every single time you administer medication. As the patient states their name, you are simultaneously reading the label on the medication bottle and the label on the MAR. Right time. Does the administration time match the doctor's order? Medications need to be administered at the appropriate time or times for effective outcomes. Before administering medication, verify specified time intervals have passed. Right route. Pay close attention to the administration route that is specified on the medication label and the medication order. Can this medication be crushed or mixed in other substances? You should never crush an enteric-coated tablet or open a sustained release capsule. Does the route or route match the order? Tomato, tomato. Right documentation. Document immediately after medication administration. If you must administer medication in the classroom, always take the pill bottle and the MAR with you to the classroom. Remember, if it is not documented, it didn't happen. Timely documentation prevents possible duplicate dosing. Right documentation increases efficiency, creates a legal record, should be accurate, should be legible, should be written in black black or blue ink, should be secure and private. Date and time should be recorded with every entry. Record of significant findings when applicable. Include precise measurements, correct spelling, and should be uniform. Right response. Assure that the desired effect takes place. Potential adverse reactions. Is the medication working? Helps measure the effectiveness of the medication's intended purpose if you are looking for the right response. It also provides quality checks and you're recording them in the student record. For example, the diabetic's response to insulin. Document, document, document. Medication errors. A medication error is any preventable event that may cause or lead to inappropriate medication use or patient harm while the medication is in the control of a healthcare professional, patient, or consumer. Such events may be related to professional practice, healthcare products, procedures, and systems, including prescribing, order communication, product labeling, packaging, and nomenclature, compounding, dispensing, distribution, administration, education, monitoring, and use. Medication errors. The greatest opportunity for medication errors are during the actual medication administration process. So here are some examples. Wrong drug, wrong dose, wrong patient, wrong route, wrong time, wrong documentation. The source of the error can be individual, the system they are operating in, or a combination of both. Failure to communicate orders to all health office staff, confusing look-alike, sound-alike drugs, administering the medication via wrong route, wrong time,